What we're going to talk about tonight is children's mental health and depression. And I know this is a big topic and it's pretty important for everybody, especially if you know somebody in your life that's been affected by this. So one of the things we want to talk about is looking at children and what are the types of things that we see in children when we're talking about mental health. And a lot of people would look at children and say the issues are primarily behavioral. So if I talk about what are your most common types of problems you're going to see in school-age children, what people are going to talk about is the kids who are disruptive, the kids who are inattentive, the kids who are basically running around in the classroom and causing a fuss. And those are the kids that get the most attention. But often what we're looking at is a different type of child as being that child who has depression. But one of the big things that we're constantly missing out on is the fact that often they're the same child, because of the way in which depression really presents in kids. And when we look at the kids within our community, we know that at this point, the statistics are telling us that 25% of the kids have issues around mental health. We know that the primary issues around mental health that they have are actually depression and anxiety. Those are the two big ones. And we had a great presentation on anxiety last month, I hear. It was very good. We know that that is probably our number one, and our number two then becoming depression. So often when we look at children and what we see in terms of their behavior, we start to ask the question, what is causing the child's behavior? What is the reason why we're seeing what we're seeing? Because in a lot of cases, when you see those kids that may be disruptive or maybe behavioral in nature, there's sometimes an underlying component, which could be depression, that's impacting on what they're doing. So what do we know about depression? We know depression exists on a continuum. It's okay to be sad sometimes. Stuff happens. We have loss in life. Things happen that create sadness. That's normal. Where we run into problems is that when that sadness starts to impact upon what we do in our everyday lives to the point that we can't function anymore, that's when we start to think of it as a clinical issue or depression. So if we look at DSM, which is the nice big fat book which tells us all about how we diagnose these mental disorders in people, realistically they're looking at a lot of different things in terms of depression. The way they categorize things, they're often looking at the way in which symptoms would present in an adult. So there actually is no child depression category. So we look for these types of things, but what we know is that the presentation in a child or an adolescent is slightly different than what you would see in someone who is an adult. So types of things that you would look for in terms of depression would include things like depressed mood, diminished interest, weight loss or weight gain, not being able to sleep or sleeping too much, being overly agitated or basically not having a whole lot of movement going on, being fatigued, losing energy, feeling worthless, having guilt, having poor concentration, not being able to make good decisions, and having thoughts of death or suicide. So all of those things could mean symptoms of depression. If you look back at the way that depression was categorized, we talk about people as having normal patterns, and what you can see is that you're going to have ups and downs in terms of your mood. And sometimes your moods dip down into an area where we consider you to have, fair amount of sadness going on. And that could last for a period of time. But there's always fluctuations. There's another group of people who are called dysthymic. Dysthymic, often people will talk about mild depression, things like that. When you have dysthymia, what you see is that a lot of your moods are low, but they're not severely low. Whereas when we're talking about true depression, we're talking about lows that go down significantly lower than what we would expect in normal mood. And they stay down there. And you can have patterns, of course, where it shoots up in the normal area. And in cases of people who have bipolar, we see a lot of fluctuations in terms of that. But just as a general rule of thumb, you can sort of get an idea of what the difference between the three things would be. What is really sort of big from my perspective is not so much what sort of depression does in a physiological sense, but if we think about it from just a mental health standpoint, because it can have a lot of impact on us being able to sleep or do things like that. But really, for me, it's about the decision making. It's about the cognitive processing, and where does that take us? Because often the cognitive processing that occurs in kids that have depression is what continues to keep the cycle moving. And when we look at that, a lot of it comes down to what we call thinking roadblocks. And thinking roadblocks are those things that you do inside of your head that cause you to think about things in a certain way. We'll hear the term about somebody looking at the world through rose-colored glasses. Well, it's the opposite of that. So we can say through coal-colored glasses, I guess, because it would be very dark and dingy. But in essence, it's the thing that the brain is filtering information in a different way than the rest of the population. And some of these things are things that we have sort of categorized. So one of them being all or none thinking. So an individual who has depression will often think in terms of all or none. So there's no middle ground. It's always this way or this way. Very black and white thinking. We also have overgeneralization. So I can basically say, I'm assuming I'm doing a good talk tonight. And at the end of it, you're all going to clap, right? Say yes, that's what you're going to do. You're all going to clap for me. If I was depressed and I had my coal-colored glasses on, I'm going to focus in on the one person that did not clap and say that my presentation was a complete and utter failure because one person did not clap for me. Don't be that one person. Overgeneralization is a problem. It's something that people do. The negative filter, like I said, the coal-colored glasses, the idea that we are looking through these kids' eyes and the way in which they're interacting with the environment, they're not seeing things the same way we are. They're seeing it from a very negative standpoint. Discounting positives. Again, like I said, you can tell somebody great job, but if they're only focused on the one thing that they knew that they screwed up, it doesn't matter how good of a job you tell them that they're doing, because the focus is on that negative. Jumping to conclusions is another one. So the idea that one small thing that goes wrong is going to have a impact in a negative way later on, which brings us to the magnification and catastrophic thinking, in that the one small thing that goes wrong is going to have a huge catastrophic effect in the future. So one little problem, one big negative outcome. They also tend to go more towards emotional reactiveness, which really means, from the standpoint of processing, is that instead of thinking about the logical things in a situation, things that might make sense to most people, they're focusing on the emotional reactivity of the situation. So if they start to get basically agitated and increase their level of activation from a brain standpoint, they don't really focus in on what makes sense. They focus in on what is most emotionally salient in that situation, which means they can pick up on a lot of the negatives. And the last one, of course, is personalization, because it's always about them. It doesn't matter what happens. It doesn't matter what happens outside. It doesn't matter who's involved. It all boils down to them. They're responsible in some way for something that's happened. So there's a lot of really negative focus inward on self when we look at all of these things. And the idea that there's something from a self-esteem standpoint or a just self-reflection standpoint that does not allow them to be able to see the world the way everybody else sees it. So we say contributing factors. What causes depression in children and adolescents? And the answer to that is, I don't know, because there's no simple answer to that. One of the things that we do know is that depression is very heritable. So if you have a parent or a first-degree relative, let's say, or even in some cases second-degree relative that has depression, there is a high probability that that child will have a predisposition towards depression. And what does that mean? That doesn't necessarily mean that they will get it or not get it. What it means is that they are at a higher likelihood than any other child to develop those symptoms at some point in their life. What tends to draw it out is environmental. So, we have this whole nature-nurture debate in psychology, which everybody hears about because it's Psych 101. The answer is both in this case. There's usually a genetic predisposition, but it's usually brought out by environment. So realistically, at the end of the day, that's what we're looking at. We're looking at family history and environment. When you look at it from a genetic standpoint, what we know is that a lot of what we're seeing has to do with the way the chemicals work in the brain. But what we know is that as the environment changes the way in which the brain works, that the environment can in fact alter the rate at which the chemicals are created and destroyed, which changes chemical patterns in the brain. So environment plays a role from a brain standpoint. We also know that context, or things that happen within a situation, so that could be things like traumas during childhood, for example, abuse, neglect, divorce, violence. If you think of the kids who are currently immigrating here, who've come from very violent areas in the world, and what they have seen or heard, all of those things can have an impact on the way in which the brain develops. So those things then, if mixed, let's say, with that predisposition within the brain, causes a really good chance that symptoms will be manifested. We also know that things like gender makes a difference, because we know that it's more prominent in females than it is in males. Just like some other disorders are the opposite way around. And people like to say that's because females are more emotional and more all sorts of stuff, but really it has to do with the way the brains are put together. Because women's brains are different than men's. Yours are probably better. It goes back to when I keep talking about the fact that males are a genetic anomaly. So there's got to be something wrong with us for us to be an anomaly. We also know that things like stress and illness tend to factor into depression, because what we know about the system is that the parts of the brain that are responsible for controlling and regulating emotion are there. They start to develop before kids are born. They don't really kind of finish developing until they're in their early 20s. So what we know is that they are very moldable. They're very plastic in nature. So what happens is that if there are issues that occur either internally or externally in terms of environment, so this can be things like sleep, it can be things like hormones, it can be things like stress, anxiety, frustration, excitement, all these sorts of things will actually cause the brain to not be able to regulate emotion as well. And the funny thing is, because I know that you guys have probably all had this experience, let's say, if you start to get anxious, what does it do to your brain? You have that chance where you go in and you start to write a test, and you look at the first page and you think, oh my God, I don't know anything on here. And your brain goes completely blank. Anxiety as an emotion has the ability to shut down the brain 100%. It can cause the brain to stop thinking. So when we think of somebody who gets flooded by emotion, what does that do? That has the ability to stop the brain from processing. So when we think about it, if you've got a kid who's starting to exhibit feelings of emotional distress related to depression, and they get flooded by their emotions, what does that do? It stops the brain from processing. When it stops the brain from processing, the brain has less control over controlling the emotions, which means that it can't regulate the negative emotion as much, which then causes the negative emotion to get worse, causes the depressive symptoms to get worse, causes more emotional flooding, which then causes more cognitive issues, which causes more emotional flooding. So we can see how sometimes individuals who have depression can have these very quick negative reactions, negative responses, where they can go from being seemingly okay at one moment to having a complete meltdown in another moment. where we see kids, for example, who can be crying and can be a puddle on the floor, or we see other kids who will have a complete and utter aggressive outburst in those circumstances. But what we know is that this is coming from emotional flooding. So things like stress and illness, of course, are impacting on the internal environment, which then causes that brain not to function as well and increases the likelihood that you're going to have the emotional reactiveness. So, from a childhood standpoint, because kids are a little bit different than adolescents, so I want to talk about them differently. There are basically 4 different categories of signs that you look for in kids when we're talking about depression. One is emotional signs, one is cognitive signs, then there's physical signs, and there's behavioral changes. Not every kid, especially when they're little, who experiences depression shows every one of these symptoms. We don't see them across the board. You're more likely to see global symptoms in adults than you are in little kids. So, some of the emotional signs. So typically with the emotional signs, what you're going to see is sadness. That's a common one. But quite frequently, especially when we're talking about younger kids don't show the sadness component so much, and they will likely either show anxiety or anger and irritability instead of sadness. So when you get these young kids who are exceptionally irritable, that could be a sign of depression. We do also look to see if that impacts on their ability to engage in certain activities. Is it impacting on that pleasure and interest component? Because in some cases it does. From a cognitive standpoint, of course, we know about those negative thoughts and those roadblocks that we talked about so far, but from just a plain information processing standpoint, how well does their brain work? We know that they can have problems with organization. They start to become disorganized. They can't put things together the way that they used to. We do see that negative view come through and those feelings of not being good enough, but really what you see cognitively is it coming down to that helplessness and hopelessness. And that the idea that they just give up. And I think we've seen that sometimes in kids within classrooms, that what we see are kids who get in classrooms, they get frustrated, they get upset, they throw tantrums, they can become aggressive, they can throw furniture, they can do all sorts of stuff. And at the end of the day, what we're seeing is just a real level of helplessness in not being able to cope with what's going on around them, and hopelessness in the sense that it's not going to change. That really their only attempt to integrate into the environment becomes their ability to escape from what's negative. And because they can't just get up and walk out of the classroom, and we continue to put demands on them, that will often lead to the behavior that they see. You will get, in some cases of kids, in pretty significant cases, some feelings of isolation and in some cases suicidal thoughts. And people talk to me about that all the time and say, how can kids have suicidal thoughts? Kids' lives are great. They're little kids, what do you expect? I have seen suicidal 5-year-olds. It happens. We can't assume that just because you're a child, your life is great. Your life may have been great when you were 5, but that doesn't mean everybody's life is great. And it's very hard for anyone to really take the perspective of another person unless you've lived it and experienced it. You don't know what it's like for that person in that environment. Some of the physical signs you see in young kids is that you'll definitely see the changes in appetite. That's usually fairly common. They'll either stop eating or start eating a lot. Sleep disturbances are very common. And of course, sleep disturbances don't help when I talked about the fact that earlier emotional regulation is affected by lack of sleep. So if you've got a child that's not sleeping, because quite commonly what you'll see is that they can't get to sleep, or they wake up and can't get back to sleep, or they have a really hard time waking up. Those tend to be your common patterns. If they're not getting the appropriate amount of sleep, we know that's going to have a negative impact on what they are capable of doing the next day in terms of emotional regulation. So that's where that sluggishness comes from. The agitation then comes from the fact that A, they don't have enough sleep, and B, they are constantly in situations where they're having difficulty coping. And then, of course, you get to the most obvious signs, and these are the ones that tend to everybody to pick up on because they're probably the most problematic in terms of day-to-day activity. So number one is your avoidance. So they keep trying to get out of certain things or withdraw from things. They can also tend to be very clingy or demanding. So, often we'll see them, they're often around an adult, they're needing a lot of support, they need to make sure that there's somebody there to comfort them all the time. Sometimes you'll see them to be overactive. They could be the ones running around. And you'll think, that kid's not depressed. Look at them, they're up and running around and whatever. But sometimes that level of agitation that they have internally, they have to get out, and that's the only way to get it out. It's that restlessness. And occasionally what you'll see is self-harm. Again, you don't see that very frequently in kids who are young, but it does happen. Okay, adolescents are a little bit of a different animal, as we all know. Most people would say they're a type of animal that needs to be caged. We were all adolescents once. We all deserve time in that cage. Adolescents are a little bit different, really. One of the things that we see about them is that they, from a depression standpoint, often present with symptoms that are very much more similar to adults, because we want to say that adolescents are kind of like miniature adults compared to kids who are completely different. But at the same time, adolescents aren't adults, and we all know that. Because if they were adults, they would behave like adults and not like adolescents. So the adolescent brain is a different type of brain. It's a kid's brain that's been upgraded to a somewhat adult brain in a system that can't control it, is basically how it works. So what we know is that we're not going to see the exact same pattern in that group. So most of the symptoms are similar to what we would see in adults. However, it's kind of difficult to diagnose depression in teens because they're moody, right? Teens tend to have problems regulating their emotions. That's a normal thing. So when you have a teen that has problems regulating their emotions, we say, is that just them being a teen, or is that something else? So sometimes we have to really, really pay close attention to what they're doing and what they're feeling to be able to sort of make that discrimination between the two. Also, because like I said, adolescents have an upgraded brain in a system that can't handle it. It's like putting an engine for a bus into a little tiny smart car. It's going to lead to problems. So having all of that, if you want to call it power under the hood, often is very difficult for you to understand what that means, because it's a very different experience than what you have when you're 6 and 7 years old to be able to have that going on. So even if I ask the adolescent, say straight out, you feeling sad, you feeling depressed, they will answer no, because they don't know. It's hard for them to answer that question because they don't have a baseline. They don't have something to compare it to. And it takes some brain maturation before adolescents are often able to make those self-reflective comments and to have that same level of insight as you would see in an adult. So here are some of the things, and you can see it's a long list of things that are often associated with depression in adolescents. So these things include things like poor performance in school, withdrawing from friends or activities, sadness, hopelessness, lack of enthusiasm, energy, or motivation, anger and rage, overreactions, feelings of being unable to satisfy ideals, poor self-esteem, guilt, indecision, lack of concentration, forgetfulness, restlessness, agitation, changes in eating or sleeping patterns, substance abuse, problems with authority, and suicidal thoughts or actions. That's a lot of stuff. And when you look at it, you can say, half of that stuff is normal for adolescents. Some of that stuff is normal for adults. It depends on what your life is like. So when you think about this, it's not even with these lists of things to say, well, just because this person is overreacting to criticism, that they're now depressed. That's not the way it works, because sometimes we can have those and they're normal reactions. So again, it comes back to really having that close monitoring. Some big red flags that I like to think about in terms of our adolescence. Number one is teens tend to experiment with drugs or alcohol. And that can be problematic during this period, especially if they have signs of depression. They can also be sexually promiscuous during this period. And realistically, what we're doing is what I like to call self-medicating, in a sense, because they're trying to do things that will make them feel better. So they tend to engage in these activities as a way of coping. However, by doing that, that tends to get them into trouble in other ways. You may also see the teens expressing their depression through that very externalized manner, similar to what you would see in younger kids, where they're being very hostile, they're being aggressive, they're taking lots of risks. Because again, it's that idea that they can't manage the overflow of emotions that are coming through that brain. And as a result, what you're seeing is that that stuff is leaking out and they don't know what to do with it. I think about it as almost like a venting process. So if you have a machine that is creating lots of heat, the one thing it's going to do is eventually blow heat out through the vents to make sure that the machine doesn't melt down. That's kind of what the brain is trying to do by letting this stuff out, because these kids can't cope. So, big problem though is that when you're angry, when you're aggressive, when you are using the drugs and alcohol, you're tending to then basically burn bridges with everybody, because you tend to be overly negative with them, you tend to get into fights with people, you tend to do all these things that will tick other people off where they don't want to support you anymore. So it becomes very, very challenging, because in the time that they need you the most is the time that they are pushing you away the hardest. So we need to make sure that we're doing what we can to try to remain supportive, even in the face of stuff that we really don't want to deal with, in a time that we really don't want to deal with it. Okay, suicide, always a fun talk. All right, 4 out of 5 teens who attempt suicide have given clear warnings. Number one thing that I will say is that suicidal ideation is quite common for individuals who are depressed. I would say almost everybody who has had depression has had suicidal ideation. It's a small group who will actually verbalize it or act on it. So just because those thoughts pop into your head doesn't necessarily mean that you're a high risk. However, for some people, they tend to become a high risk. The one thing I can say about the high risk individuals is that the majority of them are engaging in the high risk behavior because they want help, and they have no other way of communicating it effectively to the people around them. And typically, the ones who, that 1 out of 5, who doesn't give clear warnings, is the one who really wants to go through with it. Because somebody who is willing to go through with it is not going to tell anybody who can prevent them or stop it from happening, because they are basically set that this is how it's going to go down. If they're giving warning signs, they're there for a reason. It's because they're reaching out, basically. Even the attempt in and of itself is often a way to reach out. So we look at things like suicide threats, direct and indirect, obsessions with death, poems, essays, and drawings that refer to death, giving away belongings, dramatic changes in personality or appearance, irrational, bizarre behavior, overwhelming senses of guilt, shame, or rejection, changed eating or sleeping patterns, or severe drop in school performance. So, again, let's think about these things for a second. Half of these overlap with the symptoms for depression. So, again, just because you see them doesn't mean that it exists. So that's number one. Second thing is that we can't make too much out of anything. We always have to take things within context. Just because somebody writes a poem that's rather depressing does not necessarily mean that that person is suicidal. I will take, for example, Edgar Allan Poe, who wrote a whole book of depressing poems that are now quite famous, and he was depressed. However, I don't believe he was suicidal. So sometimes people use art as a way of expressing their emotions and as a way of communicating. And we have to take it as that. So just because they do that, not a biggie. I would say, in fact, if anything, out of all of these things, if I was to say the one thing on that list that I would be the most worried about would be giving away belongings. Because that is a sure sign that somebody is thinking a certain way and making decisions, that they no longer need these things. And why is that? So treatment. Treatment's a really good one. Treating children with depression is not easy. And the reason why it's not easy is because half the time we don't know that they have it. And that's what I talked about earlier. Really, we're not good at identifying those kids that have depression. We identify them as lots of other things. ADHD, ODD, sometimes anxiety. But really, depression is not something that we often will have diagnosed in a 6 or 7-year-old kid. Even when it's there, people miss it. So treating them when they're really, really young is kind of a situation where, well, if we know it's there, we might be able to do anything, but most of those kids get missed. If we do know that it's there, the second part is, what do we know about treating depression? What is the best gold standard treatment for depression? Cognitive behavior therapy. Because we know that the bulk of the things that keep depression running in the brain are those roadblocks that we talked about earlier, the cognitive roadblocks, the thinking patterns that are negative. So how do we change the behavior that comes from the negative thinking? We change the negative thinking. Cognitive behavior therapy works wonders. Problem is, 6 and 7-year-old kids aren't the best candidates for cognitive behavior therapy. Because they don't tend to come into an office and sit on a couch and you say, so how are things? That's not how you interact with a 6 or 7-year-old child. So when we talk therapeutic interventions with kids who are a lot younger, we can't really get into cognitive behavior therapy in its truest form. We can do little hints of it, but there are other things that we often have to get into. So in the most severe cases of kids who have depression, what I would say is that you're typically looking at medication as being your number one likely treatment modality, because it's the easiest one to have the quickest impact, because the therapy takes a little bit longer and is more indirect. If you're older children, so once we get into that 10-year-old range, let's say, the CBT is fine. It's a lot easier to do CBT with a 10-year-old. So at that point, your number one treatment tends to be more along the lines of having the cognitive behavior therapy and then the medication if it's required. And if we can catch this early enough, usually with the young kids, then what we're looking at is they will do well with the intervention without necessarily requiring the medication. Adolescents, on the other hand, again, cognitive behavior therapy is the way to go. But we have a couple of different problems with cognitive behavior therapy in adolescence. One of which is it requires the adolescent to participate. And I can't force you to take cognitive behavior therapy. Can't put it on a spoon and hold your nose and shove it in your mouth. It's not something that we can do without the participation of the adolescent. And depressed, okay, let's put it this way. Adolescents normally are not going to be the best people at sitting down and having a conversation with, especially if you're taking them somewhere to have a conversation with somebody who's a professional. A depressed adolescent, on top of that, not necessarily going to buy into this very easily. So it's a tough one to get adolescents sometimes the help that they need, unless the adolescent is the one saying, I need to talk to somebody. And at that point, when you have the buy-in, it's a lot easier. So typically, even though CBT would be the method of preference here, often most of them are treated with medication, which they take sometimes inconsistently and then mix with the drugs and alcohol. So it's not necessarily the best option either. That's why adolescents take a different level of care when it comes to these symptoms of depression. The other thing we have to be really, really careful about is one of the things we know about the SSRI drugs that are used to treat depression in adults is that in adolescents, they can actually lead to increased suicidal ideation. So for the first couple of weeks that an adolescent is taking an SSRI, we are keeping a very, very close eye on them to make sure we know that they're okay and they're not having any suicidal ideation. Because you can have a depressed kid who is not experiencing any of that stuff but is just depressed, and the medication will actually trigger that to occur. And we have to watch out for that. So, what can you do? Because this is what this is all about at the end of the day. I'm sure you're not here just for fun. You want to know, how can I help? One of the things I usually will say is we really have to keep an eye on the good things. You need to make sure we're reinforcing, make sure that we're exploring as many positives as we can. Because the truth of the matter is that for every 10 positive things that happen during the day, the chances are they're going to remember the one negative. So if we can overwhelm them with positives, that's a good thing. It gives them more of a chance to actually see some of the positives over time. It starts to challenge some of those negativity rules that they have in their thinking. The second thing is you need to have consistent and clear rules. All kids benefit from rules, even adolescents, even if they don't want to admit it, they do. But we need to be very consistent and clear in that. We need to keep enforcing them, even though it sometimes does not cause the best situations to occur. The rules are very important. You also have to be very calm. It's no good to get upset with them, particularly if we're talking adolescents. But even with little kids, you get little kids who start to have a behavioral meltdown because of symptoms of depression. Getting upset with them is not going to help. It's going to upset you. It's going to upset them more. And at the end of the day, nobody is going to change anything from that. So we end up with a bunch of upset people. Keeping calm and being able to talk to them calmly, model calm, is very, very important. Listening is very important. And I don't mean sitting and, okay, talk to me and now I'm going to listen. But I mean listening in a general sense, in that when they come home from school and they make a comment, you always have to be thinking about, what does that comment mean? Where did that come from? How should I respond to that? So it's always about picking on those little things and how can I tweak it? Because the thing is that if I'm thinking something occurred based on the comment, I may not want to go in there with guns blazing and attach right onto that. But at the same time, I do want to find out what went on. So how am I going to approach it? What's this day look like? What's their mood look like? We always have to be listening for those little subtle nuances to really get an appreciation for where they're at. Because if you can connect with them where they're at, you're more likely to get something than to try to force it to occur in an interaction. So, in keeping with that, spending time with them and being part of their life rather than just parachuting in and demanding things and telling them to do chores and all this kind of stuff. Having that interaction with them on a daily basis and trying to be a part of what goes on in their life will often make it easier for them to talk to. Because what we know is that a teenager, or a child for that matter, only requires one person in their life who's an important figure who they have a good relationship with. And that can be a parent, but it can be a teacher, it can be whoever. But it's the person who spends time with them. It's the person who will listen to them, who is there with them. That's the person that they will go to. And that's the person that they need. So being able to do that makes a huge impact that I think not a whole lot of people appreciate the difference that that makes in a child's life. Okay, accepting that the behavior occurs, not the behavior. Here's another one of my favorite ones. So you have to be understanding of the fact that kids who have depression are going to do stuff that you don't like and don't agree with and is not socially appropriate and all other sorts of things. And we have to be accepting of the fact that that's going to happen. That comes with having the disorder. It doesn't mean that we have to say, I'm okay with that behavior. We can still talk about how appropriate it is or how inappropriate it was or whatever in that context. But you can't punish them for engaging in a behavior that's beyond their control. So that leads to the last point, of course, is that punishments need to be appropriate. We shouldn't be punishing for things that are beyond kids' control. Because in fact, punishing them for things that are beyond their control reinforces the feelings of helplessness and hopelessness and will actually make the depression symptoms worse because they see it as, it doesn't matter what I do. This is always the outcome. And I can try really, really hard, and what you do is you punish me because I did this, even with all these things that I did before. That's what they see. And because they focus on the negative, the punishment has a greater impact than any reinforcement you're going to give them. So you have to be very, very careful about how you use it. Okay, other tips. So, helping the child to identify the positives. What are the types of things that we can do to make these kids see all of the positive types of things that are going on around them on a day-to-day basis? So when they talk about the fact that one person didn't clap at their seminar, you can say, but you know what? There were 100 people there and 99 of them did. And look at what a positive impact you had on 99 people. You know, that's the type of way that we have to look at it sometimes. Helping them to have statements to say to themselves in those circumstances so that they have a way to self-talk or a way to say to themselves, it's okay that one person didn't clap for me. I'll live. You know, look at all the other good things that I did. Giving them those coping strategies. Helping them to connect their thoughts and their feelings so that they can start to process as to sometimes when their thoughts don't make sense. So me thinking that just because one person didn't clap is going to then, I'm going to go to work tomorrow and get fired because I suck. That's catastrophic thinking, and it's irrational, right? That's not the way that it's going to happen, but if that's the way your brain is working, you need to have the ability to look at that thought and say, that doesn't make sense. Why would that happen? How are the two connected? Why is one going to cause the other? Where's the relationship there between A and B? So being able to help them walk through those thoughts and how those thoughts then lead to certain behaviors that they may engage in is very important. Having success activities is important. So one of the things we like to do is to make sure that we have kids have lives that are full of success. I like to use the 95% rule. I like to say on a day-to-day basis, everything they should engage in, 95% of it should lead to a feeling of success and accomplishment. If you've got more than 5% leading to feelings of failure, you've got a problem, because that's going to reinforce, particularly for kids who are feeling those symptoms of depression, the negativity. Because again, they focus more on the negative than the positive. So 10%, 20%, 30% failure experiences during the day are just going to stack up and again lead to that feeling of hopelessness and helplessness. Helping them to develop social skills. and overcome their academic problems are also very important, because we know that kids tend to have depression issues, tend to be withdrawn. They don't engage with other kids. That leads them to not practice social skills, which means they're not very skilled socially. So in social situations, they tend to do things then, number one, because their brain has irrational thoughts that are related to their symptoms of depression, but then number two, due to the fact that they don't have the appropriate social skills in the first place because they haven't practiced them. So we have two things that are going to then cause them to have significant difficulties with their peers. And of course, as we know, as we move on into adolescence and peers become a more important sort of facet of your overall growth and development, that if you can't interact with your peers as an adolescent, that's going to lead you to have some problems right there, which can then further cause the depression symptoms to become worse as they go into adolescence. Again, go back to saying, listen to what child is really trying to say. So children will say lots of things, lots of mean things to their parents too. You know, they will say stuff that you will think is absolutely horrible. And they really mean it at the time too. But you always have to think about, yes, they're telling me that they hate me. And yes, they do mean it. But what are they actually trying to tell me? They're trying to tell me that they appreciate my ability to put structure on their life. What I will often say is behavior is communication. All behavior is communication. So when you have kids that interact with you in whatever way they're interacting with you, they are trying to tell you something. Kids want to do well. They want to impress their parents. They want to please their parents. They want to please their teachers. They want to do everything well. When they are not doing something well, there's usually a reason for it. Kids don't decide to be little terrors. They do that because there's a problem in the environment. There's something that is causing them distress. There's something that's causing that behavior to emerge. So by exhibiting the behavior, they are trying to tell you that there's something not right, because otherwise they wouldn't exhibit the behavior. So all behavior is communication. So that's why I say listen to what they're trying to say. Really, it should be look at what they're trying to say as well as listen to what they're trying to say, because their words often don't mean what they say, and their behavior is often trying to tell you what they mean. And that was the most confusing sentence I've ever said. Last one, and the biggest one in this case here, is get help for your own problems. Not suggesting that you all need to go out and get help. But one of the things we know is that when kids have depression, one of the things I started out saying tonight, it's a heritable issue. It means the chances are there's a first-degree relative that has it. So that if a child has depression and the mom has depression or the dad has depression, and the mom or the dad is not receiving treatment, then the mom or the dad, their emotionality, their way of processing information within their environment, their way of interacting with the world is going to then flow over and impact upon the kids. So even if I was to take that child in and provide them with treatment, the environment that they're in with the parent who has the same issue, who is untreated, is still going to cause negativity to occur in that child's life. So that's why I say the parent or the person that they're spending the most of their time with also needs to get help for that issue if they're not, because it's really, really important. So here's my last slide for questions. So I want to say one thing about this. Number one is, because there's a new Star Wars movie, I had to use a Star Wars slide. As you can see with the stormtroopers, it's hard to tell how a stormtrooper is feeling because it's not completely obvious. You can look at them, you can talk to them, you know, you just can't tell. This is what it's like with kids with depression. We can't tell. It's not easy to tell how that child is feeling, particularly when we're talking about little kids. So often we have to do a lot of work to actually see What is underlying that? Got to take the helmet off, see what's going on under there. I think that's what the important thing is. We really have to get a good feel on them, because those kids have a huge amount of potential. And I've seen kids who have come out the other side of depression who've done wonderful things. And unfortunately, I've seen the flip side of kids who have had very, very difficult lives up to the point of their adulthood because their symptoms have been untreated. So we know that these kids, if we can find them early, if we can work with them, they're going to do really, really well. So the tricky part is just identifying and then figuring out how we're going to intervene. So I'm going to leave you with my stormtroopers.